Okay, this is Kennedy. I'll be doing my medication competency. Here we have Mr. Brad Pitt. Brad, can you please state your name and birthday?
Brad Pitt, May 28, 1973.
Yes, sir. Thank you. The doctor has scheduled a NPH insulin for you for your diabetes at 7 a.m. before breakfast. Can we go ahead and get started with that?
Yes.
Okay, great. The dose is 6 units of NPH insulin, subcutaneously routed before breakfast. We're going to go ahead and do it in your abdomen, 2 inches away from the belly button. There's other areas you can do, like your posterior upper arm, your thigh on the side, and your upper gluteal, and your scapular areas. But we're going to do an abdomen today, and it is 6 units, so we're going to grab our 0.5 milliliter, 29 gauge needle for insulin. With our alcohol swab, we're going to take our NPH insulin and clean the top. Roll the insulin where it's room temperature. Grab our needle, our skin, clean the skin with a alcohol wipe. Get the needle ready. We're going to draw air of 6 units. Puncture the insulin. Push air in. Turn over and draw insulin of 6 units. Watch for air bubbles. Grab the skin, pinch the skin 2 inches away from the belly button. Administer 90-degree angle. Wait for a few seconds and absorb. Then release. Push your safety and dispose in the sharps container. Okay? You feel all right, Mr. Pitt?
Yes.
Okay, great. And I will be back for your next scheduled medication. It is now 9:00 a.m. and our patient is scheduled for Lasix 60 milligrams and Prilosec of 20 milligrams, both by mouth. Mr. Pitt, is it okay if we take both these medications at the same time or separately?
At the same time.
Okay. Can you state your name and birth date one more time?
Brad Pitt, May 28, 1973.
Okay, and are you allergic to anything?
No.
Okay. Let me see this. I will show my calculation. So our Lasix is desired dose of 60 milligrams. We'll take our desired over what we have, 40 milligrams times 1 tablet. The patient will receive 1.5 tablets. 1 and then half of this tablet. Here is this. Take it with water. Okay, thank you. And then our next 9 o'clock medicine is the Prilosec of 20 milligrams by mouth. 20 milligrams of our desired over what we have times 1 tablet is 1 tablet. Here's your water. Your Prilosec is to relieve heartburn, and your Lasix is to reduce the fluid in your body for edema. Okay, you feel okay? All right. Need anything else?
No, ma'am.
Okay, thank you. I'll come back for your next scheduled time. It is now 10 o'clock, and the patient is scheduled for potassium, amoxicillin, and diazepam. Okay. Can you state your name and birth date one more time for me?
Brad Pitt, May 28, 1973.
Okay, thank you. And you want to take these together or separately?
Separately.
Okay. So let's start with our potassium. It's for your potassium levels. And we want the dose of 16 over 8 times 1 tablet. The patient will receive 2 tablets of potassium. take this with water. Thank you. And our amoxicillin is 250 milligrams over our given 250 milligrams times 1 tablet is 1 tablet by mouth. Here you go. And that is to treat infection. Thank you. And next is our diltiazem of 360. Our desired dose 360 over 180 times 1 tablet is 2 tablets. With water. Okay, great. Okay, everything went smoothly. You need anything else?
No, ma'am.
Okay. So I hear you're complaining of pain. Can you rate your pain level on a scale of 1 to 10?
6 or 7.
Okay. I'm gonna go check tomorrow real quick and see what kind of pain medication I can give you. So here we have our patient. The patient can receive morphine sulfate, 10 milligrams of over 1 milliliter, and the patient can receive 2 milligrams intramuscularly every 4 hours as needed. So before administering, we will determine our site intramuscular. We can do our deltoid, our ventrolateral, or our ventrogluteal, which is on the side. This is on the anterior thigh or our upper arm. We are going to do our deltoid muscle. Let me show you the equation. Because our desired is 2 milligrams over 10 milligrams times 1 milliliter is to give the patient 0.2 milliliters. So we will use our intramuscular needle of 1 milliliter, 25 gauge. We will make sure we have the right patient, the right medication, and our right dose, and our right route. We will draw air to 0.2 milliliters. And cleaning the top with an alcohol swab first. We will push in our air. We will turn over and draw up 0.2 milliliters. Tap for air bubbles. Release. Clean the skin with an alcohol wipe. Do the Z method, where we spread the skin. Insert dagger light at a 90-degree angle. Let it absorb and release, and put on your safety and dispose in the sharps container. And after the pain medication is administered, we will check on the patient for their pain level every hour. And we will also check the muscular site if it is any for redness or soreness. Okay, and the patient did receive all the scheduled medications and its pain medicine. Now, if our patient was on an NG tube, we would discontinue the feeding 30 minutes prior. We would check their gastric secretions and measure the pH level less than 4. And per doctor's order, we will administer the medication. Before administering the medication, we will use 30 milligrams of water before administering. With each medication, we will dissolve with 5 to 10 milliliters and use 5 to 10 milliliters of water in between. If the patient does have a ECEL tabs, we will not crush, and we need to call the provider to change the form of medication. For these medications cannot be crushed. And after administering each medication, we will dilute again with 30 milliliters of water. We will not continue the patient's feeding for another 30 after medication. And before, we will make sure our gastrics or fluids are less than 200 milliliters before administering. And make sure the patient is at a 45 to 90 degree angle sitting up in the bed. Okay? And that is it for my video.